So I'm Dr. Jean Monro, and I'm the Medical Director of Breakspear Medical. This is a facility which is devoted to environmental medicine and to nutritional medicine. And in this field, we look at different aspects of people's health. So it covers the gamut of medical conditions, any chronic condition, but even acute conditions have environmental medicine aspects. If one were not to look for causes, one could administer, say, a drug, and it might control a condition. But if one looks for causes, then one might have an opportunity of either arresting the disease or even reversing it. So amongst the things we look for are whether foods can be contributing to someone's health or ill health. People can have food sensitivities when they cannot tolerate particular foods, or they might not tolerate components of foods. For example, gluten or milk are not tolerated by everybody. There's a large proportion of people in Ireland, for example, who are both milk and gluten intolerant. And throughout the world, perhaps half of the world's population is intolerant of the lactose component, which is the sugar in milk. So we look for other things, of course, not just the principal foods, but perhaps other components of foods people can be sensitive to, such as salicylates. And these are the aspirin-containing components of some foods, and many people develop urticaria or other conditions with a sensitivity to salicylates. We also look at chemicals, not only the body burden of chemicals, that is what we've all encountered and met and accumulated in our bodies, but also the fact that this can sensitize the person. People can develop heightened sensitivities to foods and to chemicals as well. It is becoming apparent that electrical hypersensitivity also exists, where people can no longer tolerate having, say, Wi-Fi in their vicinity, use mobile phones, use computers. So we find that these are all parts of a continuum where people develop sensitivities to foods, chemicals, and electrical equipment. And if one can treat these and restore some semblance of normality for the person, it allows us to perform a normal activity of daily life. So in seeing patients, we look at their body burden of chemicals, but we also look at their own inherent ability to be strong, and this depends upon whether or not they have nutritional deficits. We look for nutritional deficits as we go. So food sensitivities, chemical sensitivities, electrical hypersensitivities, all can stem from nutritional deficits. You might think that in our lives of plenty that we wouldn't have nutritional deficits, but we do. And actually, the Mediterranean diet, which has been used as an example of a very good diet, comprises principally of a lot of fruit and vegetables and some foods like pasta, but and fish will be in that diet. But that diet is said to be an excellent one, and it does suit many people. But amongst the most long-lived people in the world were people from Okinawa. And there they lived in a clean area on the beach very often. They would eat seafood, have a lot of fruit and vegetables that they could grow locally, principally the very dark vegetables, purple sweet potatoes, and they would scavenge seaweed from the beach. Seaweed contains quite a lot of iodine, so they were not short of that. And these people lived till over 100. So they lived healthy lives because their diets were good and they had clean air. So we think in terms of trying to replicate for any individual what is ideal for them as far as their diet is concerned. In Breakspear, we also consider infections. And it's extremely important to be aware that these can be very debilitating and they can last in a person. They can be long-lived, and they pull down a person using their resources, so that the best thing for us to do is to ascertain if there are any of them that are active. By the time we're 90, all of us will have met the Epstein-Barr virus, the glandular fever virus. But if it's contracted, say in the 20s, and in a vigorous form, then it can be very debilitating and lead to many illnesses. Treatment against such a virus becomes imperative if a person is to regain their health. But we look also for bacterial infections. Bacterial infections can infect and infest a particular part of the body, such as in the mouth. We can have infected teeth or tooth sockets. But there are also bacterial infections and viral infections which affect the entire body and can be chronic infections. And one such is called Lyme borreliosis. So we look for this in patients too. So what we do at Breakspear is to do examinations of people. We check them over physically after taking a history. We look at their occupational history, their environmental history, what they're encountering in their homes. Incidentally, there's more indoor pollution than outdoor pollution. And also, which of the many 30,000 odd chemicals that one might have in the way of cosmetics or cleaning agents will be incorporated in a person's body? Which of them have actually got into the person? So we would examine the person after taking a history, and then we would do some special tests which are available to us. And one of them is neurophysiology. Neurophysiology is evaluating how the brain works with regard to its electrical activity, and it can tell us about how the lungs work, how the heart works, the abdominal cavity, the skin. So a lot of different parameters are measured and scored on a chart like this one, which looks like a complicated electrocardiogram, and it is a complex thing, but we are able to dissect out the different components and analyze what a person needs. The brain controls all the functions of the body, so we need to know about how it's functioning. Our neurophysiology tests are done in-house, and we do other tests like lung function tests or ECGs, electrocardiograms. And then what we would do is also do a lot of different pathology tests. And the tests are run with laboratories that we have ascertained will do the gamut of tests that we need, right through all the ones which assess the components of chemicals that have got into the body. We can do this from urine tests or from blood tests or from saliva tests or tests from genetic tests from the cells inside the mouth, for example. So these all give us a picture of the individual's needs. And we check after that, we do treatments to address all the abnormal pathology, but this particular form of treatment is called low-dose immunotherapy. This allows us to stabilize people's allergic and sensitivity reactions so that they can tolerate things that they can encounter better. So it's a retraining of the body's system, which can at times overreact. It's not to say that we dismiss their overreactions. We tell them about what they need to do to reduce their sensitivities. And we do treatments against the infections that we have ascertained. The treatments are immunization. We do immunization in a very special way. We do single things as far as we're able in order to protect a person. If a person is, for example, going overseas and they might need to be immunized and have an immunizing schedule, we'll do the things separately so that their body can adjust to having to react to one thing and is not overloaded with too many things at once. And we treat infections. This depicts a Borrelia organism, and what we want to do is to treat this because it can be long-lasting and a very pervasive organism. In some reports, it's responsible for many neurological diseases. So the precepts of environmental medicine are these. We look at bipolarity, in which people will have a reaction and then an abreaction. It's sort of a restitution after that, a period of recovery. So we know that this is going on all the time, and we see it in electrocardiograms, for example, but it's common to know about this as a normal response of the body, but it's ignored very often. This bipolarity response can be very much heightened, and we want to keep it, the body fairly stable. Then we consider what we call the load phenomenon, which is the number of things that a person is encountering all at once. They might have problems with a particular food, should we say a salicylate, an aspirin type food, and they might have a reaction to a drug, say aspirin itself. Then they might have a problem with chemicals in their environment. They might be living right underneath pylons, delivering high tension electrical impulses through the district. So there are a lot of different things that we have to consider in the load phenomenon. People then adapt to the things that they encounter, and we will all know this. If you have, if somebody is addicted, say, to alcohol, they might be able to have 5 drinks. Somebody who's not adapted to that can only have 1 without feeling a response. So adaptation occurs from constant exposure to something, but at the end, people then will have a failure of adaptation, and then a person will develop an illness as a consequence. Then we would think of their individual responses, each individual's own makeup and their own load and their own adaptation, their own bipolar responses. So we think about biochemical individuality. And we also then think about how to clear pollutants from the body. And one of the things that we can do is to use hyperthermia. Now, the piece of equipment we use is called an aerotherm. It produces high temperature from a light under the person who lies on a piece of gauze like a sling, and one can heat them, and it causes them to sweat and increases their pulse rate, increases the rate at which they use resources, so it's like a workout. And in doing this, we're able to clear quite a lot of pollutants out of the body. And then we would also use nutritional management, and we often replace good nutrients by infusions if the individual is intolerant of things by mouth, or we can do a swift recovery of a patient's health by doing infusions and helping them more quickly. So we've had some 30,000 patients, more than 30,000 patients who've successfully undergone these treatment programs. And I can just show you a couple of pictures which are very complex, but I'll just explain that this is one before low-dose immunotherapy. It's one of these tracings which shows where a person's response should be, and you'll see that the red line goes up after it should do. It doesn't reach the target properly. But if we've treated the person with low-dose immunotherapy, then it reaches its target quite swiftly. So we know we can reverse the dysautonomia, the autonomic nervous system abnormalities that we've ascertained physiologically. And this also shows that if we've done a particular test for a person, they should have a response where the arrows are. That's before they have any of that low-dose immunotherapy. After it, the target is very easily reached. And we've proved that this is also possible with the pathology tests. One of the tests that we undertake is one which tells us how much calcium there is inside a cell. And this is a picture of calcium inside a cell or outside a cell in somebody who has a sensitivity to sulfite, which is present in bagged salads, for example, or in wine. And this cell, when it was exposed to sulfite on the slide, showed calcium getting in, which is all that blue-grey colour getting in. Once calcium gets into a cell, it cannot work properly, and it's sort of silted up with calcium. We shouldn't have calcium going into the brain cells, for example. And if we've done our low-dose immunotherapy and do the same test, it just looks just like the pre-exposure test as before. So then we also measure things that get stuck onto cells. Inside our cells in the body, we've got a nucleus, and things can be stuck onto the nuclei inside the cell, impeding the function of the cell and making that person ill. So we can get rid of this, and we've done so. We've got a large number of people whom we've treated and whose chemicals we have removed from the body. We treat people with standard allergies as well, things like eczema or asthma, and I think it best to illustrate this by telling you that a particular patient with very severe eczema, before she had any treatment, was very distraught, and after her treatment, her condition completely cleared, and we're very pleased that she has. She's also wearing a gown there, which indicates her success in life. So a lot of our patients do well. We can at Breakspear use standard treatments. We have occupational health physicians infectious disease physicians, some people who have trained as in neurology and neurophysiology, professors who are experts in many fields. And so what we want to do is to offer patients a range of treatments for environmental and nutritional medicine, and we can use the other knowledge that we have also to contribute. Thank you.